And my first acts as President of the United States will be to repeal Obamacare and to repeal Dodd-Frank. And I say that as the chief author of the legislation in the United States Congress to repeal both of those policies. I led 40,000 Americans to Washington, D.C. to oppose Obamacare because I saw that at its root, it would be socialized medicine in the United States. It would drive up costs, it would reduce access, it would lead to government rationing of health care, and it would deprive our nation's physicians of true choice as they practice the vocation for which they have trained. And for Dodd-Frank, I spoke to one individual on the Financial Services Committee who said to me that there are approximately 400 new rules that have to be written to put Dodd-Frank into practice. Dodd-Frank, as you know, is rewriting the rules for the financial services industry in the United States. And of those 400 rules, he said 26% of the rules have now been written. And as a result of those rules, they will cost the financial services industry an uncompensated 11 million man-hours a year just to be in compliance. And as we all know, that comes off of the bottom line of industries across the United States, and that leads to even greater levels of uncompetitiveness in the United States. Two pieces of legislation represent socialism or big government more than Obamacare and Dodd-Frank, the signature pieces of President Obama's administration. And both have greatly hindered the creation of jobs and the capital that is necessary to fuel economic recovery for our nation. Obamacare represents the largest expansion of entitlement spending, and it's now the playground of left-wing social engineering in our country's history, and it has to be stopped. And in its place, I will reform the healthcare system by first ending the monopolies that currently exist in every state of the country on health insurance. I'll introduce real tort reform across the country, and I'll provide tax incentives for healthcare providers who give free healthcare to those who can't afford it. I also want to be able to allow all Americans, which isn't allowed now, to have the ability to purchase their health insurance premiums and pay for their copays, pay for their high deductibles, pay for their pharmaceuticals, pay for their chiropractic care, pay for whatever medical costs that they have, because everyone is different, pay for that with their own tax-free money. Individual Americans can't do that today, and I want people to be able to do that so we can address the real problem in healthcare, and that's the high cost. President Obama promised us that if Obamacare was put into place, we would see a $2,500 reduction per household on the price of health insurance. Well, just the opposite has occurred. Not only have we not seen a $2,500 drop in the cost of health insurance, we've seen a huge spike in the cost of health care. Everyone I speak to wants us to address the issue of the cost in health care, and that's what I will do.